Dementia Training with Jo Allchin. Welcome to this Dementia Awareness Training, created by Jo Allchin. In this session, we'll explore what dementia is, how it affects people in different ways, and how to offer meaningful, respectful support, especially if you're providing care at home or working in a care setting. Learning outcomes. By the end of this video, you'll be able to recognize that every experience of dementia is different and deeply personal. Describe what dementia really means, beyond just memory loss. Understand that dementia is not a natural part of aging and shouldn't be treated as such. Learn how to support individuals based on their personal needs and their unique type of dementia. Discover ways to communicate more effectively, both verbally and non-verbally. And finally, ensure you're promoting choice and independence in every aspect of the care you provide, because dignity and autonomy matter. The importance of home care. A recent Alzheimer's Society poll found that 85% of people would prefer to stay in their own homes after being diagnosed with dementia. And it's no surprise, a familiar environment can reduce confusion and increase comfort. Staying at home helps individuals maintain a higher quality of life and peace of mind. A consistent routine makes daily life smoother and reduces anxiety. Familiarity breeds confidence, and that's something incredibly valuable to someone living with dementia. Who's right? This is where we think about how people with dementia may have different perspectives. Their reality might not always match ours. Sometimes it's not about who is right, but about understanding how a person sees the world through their own lived experience of dementia. That perspective deserves empathy and patience. Mental Capacity, Act 2005. Let's talk about decision-making and mental capacity. The Mental Capacity Act says, always assume a person has capacity unless it's proven otherwise through a proper assessment. Wherever possible, support people to make their own decisions rather than taking over. Just because someone makes an unwise decision doesn't mean they lack capacity. Everyone has the right to make their own choices. If you must decide on their behalf, it must be in their best interest, with input from others if needed. And your decision should be the least restrictive to their rights and freedom, allowing them to retain as much independence as possible. What is dementia? Dementia is not one single disease. It's a collection of symptoms such as memory loss, trouble with thinking and language, difficulty solving problems or making decisions in everyday life. Dementia is not a normal part of aging. It happens when the brain is damaged, often by specific diseases. Understanding that distinction is important for providing compassionate care. Most common types of dementia. The most common types of dementia include Alzheimer's disease, responsible for 60 to 70% of all cases and the most widely recognized. Vascular dementia, caused by reduced blood flow to the brain, often after strokes or small vessel damage. Dementia with Lewy bodies, triggered by protein deposits in the brain, often with Parkinson-like symptoms. Frontotemporal dementia affects the frontal and temporal lobes of the brain and is more common in those under 65. Each type can present differently, and it's important to recognize the differences in behavior, symptoms, and needs. Common symptoms. Watch out for these signs. Difficulty remembering recent events or conversations. Trouble concentrating or organizing tasks. Struggling to find the right words or follow a conversation. Problems with judging distances or navigating stairs. Even everyday tasks like making tea, brushing teeth, or getting dressed may become difficult. These symptoms often worsen gradually, and supporting them requires understanding and patience. Other conditions that may cause similar symptoms. Not all memory loss is dementia. Similar symptoms can be caused by UTIs, dehydration, side effects of medication, depression or anxiety, vitamin B1 deficiency, alcohol-related brain injury, tumours or other neurological issues. Always report changes in behaviour so that medical help can be given promptly. Early treatment of other conditions can prevent unnecessary distress. Risk factors. Some factors increase the risk of dementia: age, gender, and genetics. Physical health, stroke, heart disease, diabetes. Lifestyle, smoking, poor diet, lack of activity, excess alcohol. Mental health, depression, social isolation, lack of mental stimulation. Even hearing loss can increase the risk and shouldn't be overlooked. Knowing these risk factors helps us make positive changes where we can. Prevention and awareness go hand in hand. Dementia does not discriminate. Dementia affects mostly people over 65, but not only. In the UK, around 70,800 people are living with young onset dementia, which means symptoms appeared before the age of 65. This group often faces different challenges and needs. And as of now, 982,000 people in the UK are living with dementia. That number is expected to grow to 1.4 million by 2040. Awareness and preparation are more important than ever. Good verbal and non-verbal skills. Verbal communication. Keep language simple and respectful. Explain what you're about to do before doing it. Break instructions into single actions. Wait patiently for a response. And check for the person's well-being. Non-verbal cues. Smile. Your face can say more than your words. Sit at their level. Use eye contact. Watch your posture. Use friendly gestures. Keep your tone calm and equal. Both verbal and non-verbal skills work best when used together and consistently. LISTEN. Let's break down the listen technique. Look interested, involve yourself, stay on topic, test understanding, evaluate meaning, neutralize your emotions. The biggest problem in communication is that we listen to reply instead of listening to understand. That mindset shift can change everything. Consistency in communication. People with dementia need consistent communication. That means everyone, carers, family, friends, using the same approach, tone, and tools. Consistency builds confidence. Confusion grows when each person interacts differently. So, work as a team and deliver one clear message. Repetition in approach, not just words, is what helps. Dealing with difficult questions. Questions like, where is my husband? When are we going home? Where's my mum? These can be emotional and triggering. Don't challenge the question. Respond gently. Try, tell me about your mum, or he's not here right now, but I'm here with you. Your sensitivity matters more than the facts. Be present and meet them where they are. Support with everyday activities. Depending on the care plan, you may support with personal care, taking medications, preparing meals and drinks, helping someone move safely, companionship, fun and stimulating activities. Each of these can make a big difference to a person's day. Often, it's the little things that matter most. Dementia affects how someone experiences the world, but it doesn't change their need for love, patience, and dignity. By understanding more, we can offer better care and help them live with purpose, connection, and comfort. Thank you for watching, and remember, compassion and consistency go a long way.